Recording started.
Hello, everyone. This is Dr. Valérie Mukanga with Healing Wings Dental, the place where we help our patients maintain and or regain their own health and smile so that they can soar in life. Today, I am excited because I have Dr. Muswamba Mwamba, who is an expert in the field of breastfeeding. And we're going to just get a lot of insight from him today. But before we dive into it, Dr. Mwamba, can you please tell us a little bit about yourself and what you do?
Okay, you just introduced me as an expert in breastfeeding. I don't like to say I'm an expert in breastfeeding because they always expect that a man cannot be an expert in breastfeeding. I am interested in breastfeeding. I work in the field of breastfeeding not because I want it, it's because I'm a learner.
Mhm.
I start breastfeeding not because I was interested in breastfeeding. I start being interested in breastfeeding because I was fascinated by formula. Try to
Mhm.
understand why there is so many formulas, why they have first of all why they are expensive, and
Mhm.
why they have this variety, Elacare, Nutramigen, and things like that. So
Mhm.
by studying um, formula, I wonder who they were, what was the standard. That's why I realized that it was the human milk because the human milk is alive. So it
Mhm.
keeps changing. That's why they have so many variety of formula. And that's why I started going deeper and deeper and trying to understand the benefits and of human milk. So
Gotcha.
that's why they say
Gotcha.
I'm an expert. I read more and I work with mom, and then because I was a male, they say no, don't work with mother, work with man. So basically, what I do, I work with men to support mom while nursing. When you are
Mm.
saying nursing, breastfeeding, you have to consider the reality that when you talk about breastfeeding, people talk about pregnancy. If you talk about pregnancy, they're going to talk about parenting. So somehow it's not being connected. You
Mhm.
start with breastfeeding, you end up with parenting.
That's very, very interesting. So then tell me that's very interesting because, yeah. So you wanted to learn about breastfeeding and it led you this way, and you're now on the path of parenting and all that good stuff. So now tell me, why do you find that it's important then to breastfeed for a woman to breastfeed and for a man to allow his wife to breastfeed?
Uh, I grew up in Congo, and for me, breastfeeding was something that was normal because I've seen mom breastfeed.
Exactly.
So I never asked myself that there was an option. I knew there were some formula back in Congo, and I remember there was one brand was called Gigos, and I remember was stealing it because it was sweet.
I'm guilty.
So when I came to United States, I
Mhm,
realized first of all the taste was not there; it was more metallic,
mhm,
um, and then it looks like people never talk about breastfeeding.
mhm,
And only the people who have educations and maybe have more means, they will talk about breastfeeding. Um, so why people will not talk about breastfeeding? The first time I had a mother who had a 2 month old who was constipated. I was like, you cannot give them fiber, you cannot give them food, you have to give them milk, but the milk you were giving them was very rich in iron, and then was blocking the baby digestive system. Baby was
mhm,
not going to the was not eliminating.
mhm,
So I was like, why we just don't just breastfeed? Because breast milk is laxative. It helps you eliminate.
mhm,
Um, so that's why I was curious about why women not breastfeed. And doing research, I realized that the reason or the primary reason why women will select or choose to bottle feed
mhm.
was the attitude of the father toward breastfeeding. That was the
Okay.
first reason. The
Hmm.
second reason is they prefer the bottle because they can measure the bottle. They can see how many ounces the baby drank. They don't, with breast, you don't see the milk. So that was the
Right.
second reason. But the first reason that was a shocking because it was the perception of the attitude of the father or the boyfriend or toward breastfeeding. That was like, okay, I can work with that.
Mm-hmm.
But the second part, we like to measure everything. When you go see a pediatrician, he will ask you how much the baby ate. But if you are
Mm-hmm.
nursing, you cannot measure. You cannot say 5 ounces. You will say 15 minutes. But what does it mean, 15 minutes?
Right. Right.
So there is this scientific way of looking at things, the way you measure things, that is like doesn't help. They will say, doctor, or so you need to breastfeed every 3 hours, but the baby is not hungry every 3 hours. So
Mm-hmm.
we lost that part when we have to pay attention to the baby. We start paying attention to the watch. We start paying attention to your clock. That is not how the baby was designed.
Mm.
So I say we have to go back to paying attention to the baby. Breast milk is the cycle of it belongs to the reproductive cycle.
Mm-hmm.
So the body, if the body was able to build that baby and then grow that baby, the body also is ready to protect that baby. Because what
Mm.
is the first benefits of breast milk is
Mm-hmm.
designed to protect the baby.
Mm.
Because when the baby is sick, the baby can eat.
Mm.
So the
Right.
first thing it does is to protect the baby. Once the baby is well protected with the first milk that's called colostrum, then we can start feeding the baby. But our goal is not really to grow the baby, it's to develop the baby because the human milk will continue to do what the blood will doing inside.
Oh.
Because for the first year, the human baby are not about muscle, are not about bones, they're about the brain. So for the
Mm-hmm.
first year, what the milk will do and why the milk was designed is to feed the brain because this is the fastest organ that will grow. It will
Mm.
grow for maybe 200% in 1 year. That's why you go to the pediatrician to measure the length of the baby, the weight of the baby, and the circumference of the head,
Of
because
the
the head
head.
is very fast. And the
Mm-hmm.
human is designed for brain development.
Gotcha. So it's definitely so. Is that something that the formula does not address?
The formula comes from a cow's milk,
Mm-hmm.
and cow is doesn't think. A cow born
Mm-hmm.
is when the cow is born, it can calves they can walk. So the bones and you have to make sure they have bigger muscle, bigger bones.
Mm.
They are not they don't need to be protected. So
Gotcha.
you can transform it and make it look like a human milk. But remember, when you
Mm-hmm.
get a human milk, it is very dynamic. It changes according to your environment. If mom, uh, this is Texas. In Texas, it's very hot. So in when it's hot, your body knows that, and then mom will produce milk that have more water to make sure that the baby get more water. In winter, you give more fat. You have everything. It's just changing. It's dynamic. And then one thing also the baby does, the baby will control its nutrition. The baby will control how to produce milk.
Mm-hmm.
But with the bottle, you force the baby to finish the bottle because it's so expensive. You cannot push the breast in the baby's mouth. When they full, they stop. So that means that the benefit of breastfeeding, you can see that in the behavior. You can see that also through. It's a gift for a lifetime.
Mm-hmm.
The baby who breastfed have a tendency of not being overweight.
Mm-hmm.
They have a better
Wow.
bone ossification. So the human milk doesn't have a lot of calcium, but somehow it prepared the body to have a better ossification. So the baby, the, the baby when they're 15, uh, have a better bone density than the one who breastfed, the one who was formula fed.
That
So
is
I can
so.
talk about the benefits. I don't know if you have a specific question, but I can go on the benefits forever.
Wow. So now I know that you mentioned that breast milk helps in protecting the baby. In which way does that happen?
Because once the baby is being developed inside,
Mm-hmm.
the mother have the immunization system that controls everything she eats. So all the uh, immunization cells are around the guts. So it kind of scanning what is coming from the food, from the environment. So it creates what they call circulatory immunoglobulin.
Mm-hmm.
So it's preparing the baby. So so when the first milk comes, is colostrum. It's just antibodies. It's kind of antibodies, not antibodies.
Mm-hmm.
So it's your baby that will be protected because your baby live in your house and breathe your air and live with your siblings and things like that. So you already have a profile of your environment. That's what you're gonna give to the baby. When the
Mm-hmm.
baby comes, it's sterile. So when it comes from the bottom because you need to be sprinkled with those bacterias. And then when you start giving milk, you protect from the inside. So nobody else can protect your baby the way
You can.
it's only you that can protect that baby. It's a very specific.
I see. I see.
For
So
the first, yeah. Mhm.
so you find it even valuable then in a sense for women who are working to pump their own milk and provide it to the baby?
They have to pump. Unfortunately, the policy in the United States is not very friendly, but we're getting there.
Mm,
Uh, Many women in the United States
mm-hmm,
can tell you the benefits of breastfeeding, but they don't know the practice of breastfeeding.
mm,
African American, specifically here, when I was teaching classes, I will ask them, "Have you seen someone breastfeed in your life?" They're like, "I never saw a woman breastfeed." And this is a person who could be 24 or 25, she never saw. And then I
right.
may have African American, I may have African immigrant, who when I ask them, they start laughing. I'm like, what kind of a question is that? Now, when you ask African immigrant, I will just compare African immigrant and African American.
Mhm,
African immigrant may not tell you the medical benefit of breastfeeding. They don't know it necessarily.
mhm,
They know the practice of breastfeeding.
mhm,
They know it must be done.
mhm,
It has to be done. So they will figure out a way to do it.
mm,
On the other side, you have African American, born here, have the technology, the knowledge, but they understand that is important, but they don't have the practice. They don't have the know-how, and they don't have the support. Because
they
it's
don't-
good that you want to do it, but somehow also you have to have a support. I remember what I told you before, the attitude of the father
right,
toward
right.
now. So that study was done in Philadelphia and was predominantly among Caucasian.
Mhm,
But the most important person to support you doesn't have to be the husband. For African American, it will be the best friend. If the best friend is for breastfeeding, they will support you to breastfeeding. The primary person will be the best friend or the mother.
mhm,
In some culture, for instance, the Indian will be the grandma. If
mhm,
the grandma say you will breastfeed, you will breastfeed. If she's against because of they live 3 or 4 generations in the same house. So for African, we know that it's if the father is for breastfeeding, the mom will do it. If it's indifferent, she may drop it because breastfeeding is not easy.
mm,
It's not easy.
mhm,
It's important, but it's not easy.
mhm,
You need support, you need the time, and then here, unfortunately, we don't have the same provision for mom to stay home so many weeks or to have a location when they can express the milk. They start doing
right.
it at the airport. I saw, I was in California and I saw, oh, lactation room in the airport. I was like,
I saw,
nice.
yes, I saw one in the Atlanta airport last time I
Yeah.
was there. Yes, I
Yeah,
was
those are
like,
new policies. It's like the last maybe less than 10 years, maybe five. Because I remember I was among the one to go set up the lactation room at the city hall
oh
uh,
wow.
in Dallas.
Mm,
So we were the first to say, okay, you will need that. You need the fridge. You need the room. You need this kind of chair. We donate that. We set it up so as employee can use it.
oh wow. We
Yeah.
commend you. That's very, very important work. Okay. So then, I know that some women may experience, even if they want to, they may experience challenges as far as breastfeeding because they may not produce enough milk, or the baby may find it difficult to latch on. What are some of the advices or recommendation?
Yeah, baby are not confused. Baby was born with all the equipment to nurse. Uh, a human baby, if you is born and you don't manipulate them and you put them on the belly, they will crawl themselves and find the breast by
Mhm,
themselves. You don't have to out them. So they know
mhm,
it's in the hospital there is too much support. So when you have a baby in the hospital, what happened? They're gonna clean the baby, go spoke the baby, and then before you know it, the baby lose that reflex. That reflex works when the baby is just born, and you put them in the belly, they will latch by themselves.
okay.
So we have to change the policy in the hospital too to say, okay, if a mom wants to breastfeed, you have to put the baby skin to skin. The baby have to come and stay there because that baby is not hungry. They won't nurse because that stomach of the baby is like three
It's small.
it's a very small. So baby doesn't need that milk, but they need that skin to skin to feel like, oh, this is something I know, the smell I know, and that's how you start the process. When there is a separation, it's very difficult to reteach the baby
Hmm.
to latch, and then if the nurse is already there and put the pacifier in the mouth, and then that's it. That baby start you are destroying its imprint.
Okay.
So your question was, it could be difficult. It could be difficult because there is no enough support and the practice. When I say breastfeeding, is there is a technique. The baby have to latch a certain way. Most people who don't know, they will do nipple feeding. They
Hmm.
will give the tip of the breast, but you have to get the entire areola in the baby's mouth, and the baby will do a motion of uh, sucking and then massaging at the same time. So you use it two mechanisms. If you give the nipple and you think that that's where the milk is, you're gonna hurt yourself. So you're gonna have a sore nipple, and you think it's baby first is frustrated because he doesn't get the milk.
Hmm.
You're gonna insist, and then you keep biting on that, and then you will be start having some cracks, and then you're gonna abandon. The reason why your milk supply will go down is because the baby doesn't extract the milk. The only way you're gonna create more milk is by extracting the milk. Your body
Hmm.
doesn't want to lose anything. So if you want to nurse, you cannot say, "Oh, I have the baby. I'm gonna give him 2 weeks formula, and then I will be ready." Too late,
Hmm.
because the process start in this third trimester. You start making the prolactin, the hormone that control the milk, start working, start increasing, and making preparing the milk. But you don't have the milk on the third trimester because there is a placenta that is blocking the milk production.
Hmm.
Once the placenta is out, we start making the milk, but the first milk is the colostrum,
Hmm.
designed to protect the baby. You
Right.
have to wait 3 or 4 days to start having the milk, the white milk that you know.
Hmm.
But in that process, you have to work with the breast tissue. You have to continue emptying the colostrum. If you don't do that, by the third day, you have not stimulated enough. Your brain will say, "Oh, there is no milk, so let's give up." So the only way you're going to increase that is for you to empty the breast. Hopefully, you don't have enough challenge, but if that is that either by pumping, by expressing, if the baby is sleepy or the baby, you can do it by your hand, but you have to empty the breast. You have to empty the breast. If it's there, you want the body will say, "Oh, we have too many in stock. You don't have to make more." The more you empty, they're like, "Oh, more. We need to make more."
Gotcha.
Yeah, there is
Gotcha.
a transition happening, but the earlier you start, the better.
I'm learning so much. Thank you so much. This is very
Yeah.
insightful conversation. So, but there are some babies who do, drink breast milk, but then after a few months, say maybe 3 months, 4 months, 5 months, they just, stop drinking the breast milk. Like, what do you do about that?
The breast milk, I say, is difficult to
Hmm.
start.
Hmm.
It becomes very easy when the baby know what to do and the mom knows what to do.
Hmm.
So the difficulty start here and then it's going down. But the formula, the difficulty will be stay the same because you have to warm, you have to, it's gonna be the same all the time. But
Right,
breast milk, oh, especially when you have a lot of kids, that's all you have to remember. It goes down. Now, by the third month or fourth month, the baby will double the weight.
right.
Now, a baby who is breastfed will gain the weight faster than the baby who is on formula
Hmm.
for the first 3 months.
Okay.
Then it's gonna stop. The prolactin will go down. Whatever is gonna go down. But that baby now is 4 months. You have double the weight. It's around 40, 15 pounds. At that time, depending on your culture, when the baby can sit and control his head, some mothers start giving them other food.
Hmm.
Now, believe me, the food that the baby used to taste because the baby was eating your food from the inside. If you like, let's say, Congolese food, the baby has been tasting the flavor from the inside.
Hmm.
Uh, when you are nursing, the baby knows those aromas.
Right.
Okay. Now, when now you give him the real thing, the baby will don't give him the choice. He will go for the food.
That's what happens.
Okay, so my mom was very proud to say, "Oh, you start eating fufu when you were 4 months old." I'm like, "Mom, I was supposed to be a double PhD. Now you start giving me this solid food at 4 months. I needed milk for my brain development." So the truth is, for the first year of life, the primary food the baby needs is human milk or milk, human milk.
Right.
So as the baby grows, so you're gonna have a production of milk, and then the amount of milk will stay around 32 ounces, or between 30 and 35 a day. It's gonna be this. It won't increase. It will stay around. That's why you're gonna be producing every day. And beside, the baby will start eating more at one time. So when they were maybe 1 month, they will take 4 ounces. At 4 months, they can eat 8 ounces at one time. That means they won't eat every 2 hours. They may eat 4 ounces and then come back again in 3 hours, right?
Hmm.
So I'm saying ounces because I'm thinking bottle, but I'm just want. Well, on nursing, you will know that they're satisfied. They can pump and get the milk powerfully. Now, what is happening is the amount of milk will be the same until 1 year, and the baby need, not like, need the milk for the first year. Everything you're gonna introduce when the baby's full, when the baby's happy. If you wanna give him um, some cereal, rice cereal, you don't give him cereal when he's hungry because he won't like it first because he's used to the milk.
Right.
But you don't wanna replace the milk with cereal, which it's not nutritious, and the baby doesn't need it at 5 months. We
Hmm.
start giving those rice at 4 months. It used to be 4, but I will push it to 6 months when you have to teach. What you do, you're teaching a baby another skill, the skill to eat with a spoon. It's
Mm.
also a skill when they can not suck, but they can move the food from the mouth,
Hmm.
inside the mouth,
Hmm.
without sucking. So
Hmm.
this is a skill you are teaching at 6 months or 4 months, but it's not designed to replace the milk. So the baby is happy, the baby is drinking milk, the baby is full. And then the baby see you with a spoon. Now you are playing with a spoon, 1 or 2 spoons, so the baby use that as a skill. But you are not replacing that with the rice. As as the baby grow, you go at 6 months, at 7 months, the baby start being interested or discover his hand. He wants to use his hand. So when he see you with a spoon, he want to hold the spoon.
Hmm.
It doesn't mean that the baby doesn't need the milk anymore. He wants to use the spoon because he wants to see if he can put the food in his mouth. It's a skill, but it does not replace the milk. I have I have families, first baby, they're very happy. Baby 6 months, baby's 15 pounds at 6 months. They were very happy. Now they try chocolate and rice. They were Asian Indian. So they stopped giving the milk. They started giving rice and chocolate. When the baby came back 6 months later, it was only 17 pounds. I was like, yeah, but you like rice, but it doesn't need rice. Give him
Right.
rice after you give, because they stopped the milk completely because the baby loved the rice, spicy rice. So that baby was supposed to gain at least 7 more pounds. It only gained 2 pounds. So at 1 year, it was
Very
around
small.
16 pounds. It's supposed to be like 22, 23 pounds. Right? So this is the error we are, most of the family will do, and the culture maybe. When the baby is around six months and wants to play, they replace the milk with the food. No. You don't do that. You go with the milk as a first food until 1 year. At 1 year, then you switch. At 1 year, you give them the food, and then you make them drink the milk after the food. Because at 1 year, it will not grow faster. They're going to only gain 2 pounds every 6 months. And then at 1 year, they walk, they touch everything. Everything they see, they put in the mouth. So they need to touch all this floor because it's like they are giving themselves a shot. So they are putting all this dust in the mouth to boost the immune system.
Immune system.
Now, if you are too clean, you may have the baby with a lot of allergy in the future. Because I've seen also educated mother who just sterilize everything. When the baby crawl, they never touch any dirt. The baby is beautiful in the house, but when they go to daycare, you see the baby coming with a running nose and it doesn't stop. Okay.
But is there anything that I think I heard there were some cookies of some sort that enhance, or maybe I know in our culture, they say cassava leaf would actually enhance the production of milk. Is there some, some things you can actually
So the Galapagos. So every creature have a understanding on how they're going to increase the milk production. There is a two-way. There is a two reason why you will not produce the milk. So there is an internal reason. Internal reason could be you have a problem with hormones imbalance. You have a thyroid problems. If you have difficulty being pregnant, but you use technology to be pregnant, maybe that pregnancy is connected to the breast. So there is maybe an issue with tissue, blah blah blah. So this is internal problem. There is also the external. If you are in a stressful situation, if you I mentioned here a hormone prolactin. Prolactin make the milk. Making the milk doesn't mean you're going to eject the milk. To eject the milk, there is another hormone called oxytocin. The oxytocin will help you eject the milk. Now, but if you have some bad feeling and then you're thinking negatively and things like that, that thinking can affect the work of the. So if you're not relaxed, you're nervous, you may not produce the milk.
Wow.
The other thing is if you are taking some medications, if you take, let's say, Benadryl because you have allergies, Benadryl will dry the milk completely.
Oh, wow.
So you have to know which medication to take if you are nursing. So if you have allergies and you start taking Benadryl, this can stop the milk production. It's not the baby, it's the mother. There is some food, some tea or some. When you get them, they can interact also with hormones and they can interact with milk production. So because you have some that inhibit milk, there is also some that enhance the milk production. Those are galactogogue. For instance, my wife, when she have a twins, she wants she pumped. She wants to. She was making more milk than they need, so she was going in advance. So she's gonna stop. She's gonna stop. And, at one point, she was using fenugreek. Fenugreek is a herb, and he produced. No, did I check? No, but because she breastfed him 16 months and things like that. At one point, I was like, "No, maybe it's time to stop." Anyway, but yeah. So there is a many galactogog there, and then they were discovered by accident most of the time. They were not designed for milk production. They were, for
Mhm.
instance, like Reglan was designed for stomach pain. But the
Mm,
fact that the side effects for mom who were nursing was increasing the milk production. So
production.
now they're using it for milk, but in the first, like domperidone, I don't think it's not allowed in America, but
Mm,
it does have that virtue of producing more milk. So there is things that mom can use to produce milk, like in Congo they will say if you drink pondu, if you eat lavoine,
mhm,
oatmeal, things like
mhm,
that, can
mhm.
enhance the milk production. Now, there is an anecdote, there is also science, but remember, every human being is unique. If you take that and you believe it, you will produce milk. Now, it's not because it worked for you that it worked, because it cannot be scientific, it could be cultural.
I see. If people believe that it in fact induces milk and you believe so, so now it produces.
There was there is in the north in Minnesota. There is a lot of people from Somalia. People from Somalia
Mhm,
came here because of the war. So most of them were poor. So the hospital in Minnesota thought, okay, these people came from a poor country, so they will all nurse. But they noticed that when they were in the hospital, when they were leaving the hospital, none of them were nursing. Were giving. So there was like, what was the problem?
mhm.
And then fortunately there is they have family, and then some people start translating, asking them what is going on, why they are not nursing.
Mhm.
They say that we are not nursing because the food you gave us here in the hospital are poisonous for the milk, so we will
Oh,
not give them the milk because of the food you give in the hospital, so we will
uh-huh.
not give it to the breast. And the hospital policy changed, and now they say, okay, what kind of food you eat, what kind of soup. So they start providing those soup, and guess what, we
They
went
started.
back, went back in business, and the food was healthy too. So you see, there is a cultural component that we just refuse because they believe that food will not work for the baby.
I see. So belief, your belief will actually affect positively or negatively the production of the milk.
Yeah, see, there is the thing that we know scientifically that produce the milk, like some galactogog. There is a part that is negative. We are trying to avoid that, but there's a part that doesn't make a difference. That part, leave it alone. If they think some mother from Latin America told me that if you want to produce milk, you take a banana. In that case, I took the banana leaves and then rub it on the breast. I'm like, okay. Now, if it works for you, but it doesn't affect the baby, it doesn't affect the mom. The baby gain weight fine. So I don't want to talk. I won't talk about it. Keep doing what you do,
Right,
right? So those are
right.
the existential culture. It doesn't affect. They like to do it. They do it.
Mm-hmm.
But scientifically, that's where we have to go. Scientifically, breast milk not supposed to hurt. The baby is designed to breastfeed for 2 years according to the World Health Organization. 2 years, yes, 2 years. Not one. It's recommended 1 year at least, but they will push it to 2 years.
So at 16 months, you could have kept going.
For my number four, because I have 5 children, for my number four, she stopped at 16. I was not happy. I was trying for her to go for two, because that baby had some challenges with the skin. I was like, no, you need to go all the way. But she decided. Actually, she went on vacation
I
to
see.
breastfeed. She's like, oh, let me go to Florida for some fun, to California, and then that's the only way she could figure out, because the boy was looking.
So let me ask you this. What do you say to a mother who's experiencing pain? I spoke to a few ladies. They are Mexican, and they said that, when they were breastfeeding, they were experiencing pain because the baby's saliva was actually causing pain on the breast tissue. What do you say about that?
The
Or is
baby,
there something
the
that
baby saliva.
That's what both of them said. Now, I don't know if it's a belief or.
Um, how old were the baby? See, the breast could be painful. It was the breast, or it was the nipples, or you know what I mean. It's when you say it's hurting, like where,
Mm,
right?
mm-hmm.
And then you work with the mother because we don't know. It could be painful not because of the mother. It could be because of the baby mouth.
Okay.
Some baby were born with uh, high ceiling fan.
The
The palate,
palate.
yeah, if you don't pay attention to that, that will change the shape of the way the baby breast, and because it's high, they will not have enough suction because the
Mm,
baby use compression, negative pressure, and then
mm-hmm,
also massage to get the milk out.
mm-hmm.
Uh, if the mouth of the baby is not right, we have to go check if it's the baby mouth. I had a mom who could not latch, so I explained everything on paper. She said the baby doesn't stay to the breast. I'm like, okay, so at one point you finish theory, you have to see what is going on. You have to see,
Mm-hmm.
okay, show me. So my staff went and they show her the reason
Mm-hmm.
why the baby could not latch because her nipple shape was conical. It was pointy. So the
Mm,
baby could not grab on it.
mm,
So we had to reverse the baby mouth to put the baby from the top down so the tissue, so the baby can hold to the nipple.
wow.
So you don't know unless you analyze. So if they
I
say
see.
it's the saliva, they need saliva. You cannot dry the
Mm,
saliva, right?
right, right, right.
Also, how old were they?
That I don't know. I don't
What
have
they
the information.
were born here? They live in the community.
They were born here.
Okay, so maybe they want to breastfeed, but
The
they're not.
parents were the parents were not born here, but the babies were born here. So they gave birth here in the U.S.
Okay, so they may not have a support.
Mm,
So they do the nipple feeding instead of the breastfeeding.
gotcha.
So when you give the breast and you know that it's gonna be sore, this is what you do. You give the breast, but because you have to, you know it's sore, so you're gonna bend. You're gonna protect yourself because of the pain. You know it's coming, and then you do that face like that because you want to feed the baby, but you don't. And so when you do that, the latch will never be right because you have to
Mm,
have a certain position to provide the breast, to position
mm-hmm,
the baby and to position your breast in a way that there is a better latch, better interaction. But if, for instance, you have a pain for some reason, you will. I've known
change
some
the
moms, she
position.
does that face to breastfeed because she have to do that. That's
Mm-hmm.
not normal. We have to help them. There's no solution. When it comes to those, it could be the mom have a long nipple.
Mm-hmm.
It could be that the baby have a small mouth.
Mm-hmm.
They cannot open wide because they have to open wide to get the entire tissue in. They don't get the nipple; they get the entire areola. Now, the areola is a mark, but some mom have bigger areola. So when you say areola, you have to work with the mom,
Right, right.
but it's not designed to hurt. If it hurts, it's the body telling
There's a
you
problem
you're not
somewhere.
doing something right. Pay
Okay.
attention. Find the support.
Mm-hmm.
And
And
then if
mhm,
it's cracked, you don't need to stop. Because remember, your body, the milk you're producing have antibodies, so it's good for bacteria. You kill
mhm,
them.
mhm.
So your human milk is it's some of the time you don't want to stop that because it have antibacterial virtue.
Got you. So now
If you really
I
have a
know.
fever, don't stop breastfeed.
Uh-huh.
Because if the baby has a fever, that your body knows that the baby have a fever, so you start making antibodies. Don't say, oh, if you have a running nose, mom is sick. You say, oh, I don't want to breastfeed because I don't want to give to my baby. It's too late. You have to
Mm,
continue. That's how you protect the baby. If you stop,
mhm.
that baby will start having running nose.
Uh-huh. Wow. Is the action of breastfeeding, does that help as far as the development of the mouth for the baby?
Oh yeah, it's designed for the the reason some boys especially don't like to breastfeed is because they're lazy, because it require work. The jaw have to work to develop the muscle. Then if you develop the jaw, that means you're gonna have a better teeth formation, and then you're gonna also the speech will be improving and things like that. So the 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 massage you're doing, the work they do, you can even see how the baby works. You can see that they even sometimes they sweat. they, they sweat because they have work. You
Mm-hmm.
formula is when you give the bottle, the flow is faster and the baby doesn't work.
Mm-hmm.
So lazy baby love that. It come by itself, it drips, it doesn't need to work, and it's getting full. One of the frustration of the baby is not like the mom does not produce milk, is the milk flow is slow.
Mm-hmm.
So if the mix, it's because mom doesn't see, right? If the milk flow is slow and the baby is eating a growth spurt, the baby is growing because the baby doesn't grow steadily. It grow
Mm-hmm.
by, okay. So at 2 weeks you have a growth spurt. If you have a growth spurt, it start demanding. But when it's demand, your body knows it's demanding, so the body will readjust. But
Mm-hmm.
what is frustrating for him is not that the milk is not there; it's coming too slowly.
Gotcha.
So instead of 5 minutes, it needs to be like a 15 minute. It's like, man, it doesn't come fast. Now, there is also a problem of it's coming too fast.
Mm-hmm.
If it's coming too fast, it can also overwhelm the baby. The baby won't latch because it's coming too strong. We have to change the position of the mother, maybe put the mother on the floor, put the baby on top so the gravity will work on helping the baby. So some mom have forceful uh, ejection, milk
Flow.
effects.
I see. I see. So, I mean, from what you're saying, since it helps in the development of the mouth, it's definitely best to actually put the baby on the breast versus putting, using bottles. But if you don't have the opportunity to do that, it's just better to actually use a bottle with the breast milk versus,
Yes, because the breast milk, even though the baby have the teeth, remember breast milk have antibodies.
right.
It protects
Hmm.
for all the bacteria in the mouth.
Hmm.
Formula doesn't.
Right.
Okay, when the baby start having teeth, the baby's 1 year old, right? Let's say start having teeth, and then if you are nursing that baby
Hmm.
with the teeth, so the baby have this antibacterial for the milk. You have a good teeth formation, and when the baby finish eating, it stops because you cannot force the breast in the baby's mouth. What happened with the bottle? He's 1 year old. That means you know how to hold the bottle. So he takes the bottle and play with the bottle. If it's 8 ounces, the mom say you're gonna finish it. So for 2 hours, the baby is just putting milk. So the teeth is have all this milk around it. What do you think is gonna happen? That's why
Yep.
you're trying to have cavities at 1 year.
Exactly.
They are holding the milk for long. They have to stop. This is something I tell mom is you have to wean the baby from the bottle. You have to cut it, not going slow. You just cut it at 1 year. That's it. You teach him to eat in the cup because at 1 year he doesn't need that much milk. You need to drink milk and stop in 1 minute, and that's it. And then for the next 3 hours, no food, no cookies, nothing. But with milk, you will see them come to your office. They're just holding the bottle for 2 years, and then they wonder why they have cavities on baby teeth.
The last question I have for you is about what you spoke about and your inspiration, right? You said that male figures are the reason why, or partners, maybe the reason why some women do not go into breastfeeding. So, how do you actually encourage a man to
Support.
encourage that, to have, yeah, to support
Yeah,
him?
the men are funny. They are motivated by different things. For instance, when you are fully breastfeeding, no formula, you're gonna lose. You're gonna come back to your weight faster. You're gonna regain your fat. Regain. You will. regain your weight faster because the oxytocin that produces the milk is the same oxytocin that contracts the uterus.
Mm-hmm.
So the uterus is coming back to is
Normal
coming
shape.
back purposely to its regular size, right?
Mm-hmm.
You are holding the baby and the water of 15 pounds, so water and babies, right? And now you have to come back to that regular size. So that's the work of oxytocin. The more you breastfeed, the more oxytocin you have, the quicker you come back to your weight. So that
Mm.
can motivate the man. When I say,
Ah,
oh, she's gonna go back to the weight, she need to breastfeed. Okay. Second thing that motivates the man. That's physiologically. If you are exclusively breastfeeding, it blocks your cycle, so you don't have your period faster.
uh-huh.
It doesn't come faster. And some men always say, tell me again, no period, she's gonna nurse. This is the stories. This is stories of you. We try all the benefits, but as soon as I say, "Oh, she won't come back to a period for maybe a year," it's like, "Talk to me about this." Right? Third thing that motivates men, the money.
Mm, yes.
Okay. If we compare breastfed baby and then bottle-fed baby, and we look in a year, how many times they go to the hospital because of problems? The breastfeeding baby doesn't go back to the hospital because they're most of the time healthy. They don't get sick. They don't have all these issues. They don't have constipation. They have rash. Blah, blah, blah. So in terms of money, you're gonna spend a lot of money if the baby bottle feed because not only the formula is you pay 40 dollars a week or something like that, and then the
Mm.
baby can be sick. Maybe you have to go see the doctor. So you spend a lot of money.
Right.
Or you're ready to spend a lot of money because something is not going. Most of the breastfed baby don't have a problem. They come home, you go 3 months at the hospital, baby double the weight, fine, things like that. So this
Mm-hmm.
is one of the motivation. It could be money. The motivation could be physiologically. Baby lose weight, baby doesn't get sick, and
I see.
there is so many. I never find too many who are motivated by the same thing. Some is the weight gain, some is the money, some is. But men has to be involved because most of the culture, some of the culture do not involve the men in the decision of breastfeeding. Some African will say they will do it. My mother
Mm-hmm.
have done. They don't know that here we don't have the same support.
Mm-hmm.
And then there is also that place of hormones. They don't understand the wife behavior because of hormones. I'm like, their hormone change. It's not they don't do it on purpose. They
Mm.
do it. It's changing, so the body just withstand that. They don't understand it, but if you explain to them the hormones and the mood change, and they start understanding like, oh, she doesn't do it on purpose then. Oh, okay. It's like because your hormone, the testosterone, just at 12 gas there and then stay there into your 50 something.
Mm-hmm.
But women know the cycle is like that. So when you get pregnancy, it's even crazier. So when you start nursing, it's like, but what nursing does is you return to normal life faster
Mm-hmm.
in terms of hormones. I'm not talking about the term of, but the hormones in the body will, because of nursing, it will come back in order quickly than when you just leave your body. Just it will take time, maybe 6 months for it to regulate itself.
Well, thank you so much. I definitely learned a lot, and I'm sure that you have learned a lot as well, our viewers. So please, Dr. Mwamba, tell us how do if people want to work with you, how can they do so, or where can they find you?
Oh, you tell them. You know my number, right?
I know that you
I,
work mostly with groups, as you told me earlier.
yeah. So I most of the time do a lot of research. I teach at the university, but I do some clinical. So if you want to talk to me, I give you my number or I give you my email. What do you do on this platform or
You can
email?
possibly give the email. I think that would be
Okay.
good. Maybe
Yeah.
if you have a handle on your social media, that would be great too.
Yeah. So my email is very easy. So you see my first name Muswamba, and then you send me an email Muswamba at me.com, me.com.
Okay.
So you send an email, and then you tell me that if we can start discussing through the email, and then if we need to meet, we can or talk. We can do that.
Sounds good. And do you have any presence on social media?
No, I don't have presence on social media. If you Google my name, you will find me talking in conferences or the things I. You find some video. I never checked them, and my kids told me, "Oh, I found you on the internet." I'm like, "What are you doing on the internet?"
Well,
Yes, but I don't have social media yet. I need to keep up with the technology. Maybe you are an
all right.
inspiration, and I keep on social media. Yeah.
Sounds good. Well, thank you so much, everyone, for watching. I have learned a lot, and I hope you have too. If you have found this information valuable, please don't hesitate to subscribe to our channel, like, comment. If you have any question, please ask your question, and we will try to answer your question. We'll have Dr. Mwamba answer your question. If you know anyone or any places where they need a speaker that you would talk about breastfeeding, I'm sure he'll be available. He gave us his email address, which is muswamba@me.com. So, okay, so well, have a very good night and be blessed. Bye bye.
Bye bye.